Greetings. My name is Derek Day. I'm the Director of Clinical Services for Washington County Ambulance District and a member of the Washington County Incident Command that was activated in response to the COVID-19 crisis that we're all currently facing. I wanted to take a moment to provide some education regarding the novel coronavirus and the COVID-19 disease. COVID-19 is a disease caused by a member of the coronavirus family. This virus is responsible for previous diseases, SARS and MERS, which you may be familiar with. These viruses originate in animals, and COVID-19's virus made the jump from animals to humans in China in November of 2019. This particular illness has spread through several different methods, some of the most concerning being through droplets from a cough, from airborne and breathing of an infected patient, or direct contact. And recent research is indicating that the virus can survive for several hours to several days, depending on the type of surface that you are dealing with. The reason it's so dangerous and the reason that it has gathered so much media attention is because of the following things. First, since this is a novel virus, humans have developed no immunity, and so it makes it that much easier for the disease to occur. It spreads easily from person to person, and infected subjects are able to spread the disease before they develop symptoms. This, in tandem with the idea that COVID-19 has the potential to cause severe illness, is why COVID-19 is such a dangerous disease. Based on the data we have currently, which comes from the China CDC, an analysis of 44,672 confirmed COVID-19 cases revealed the startling results. Of the patients infected, almost 20% required hospitalization, with almost 5% of those requiring critical intervention, including mechanical ventilation in the ICU. If this infection were to spread to our community, it has the high potential of overwhelming our healthcare resources and causing huge problems regarding the management of these sick patients. There are several misconceptions regarding COVID-19 circulating around social media and the general public. First and foremost, COVID-19 is significantly more dangerous than the seasonal flu. The worst seasonal flu in the most susceptible percentage of the population has a mortality rate of about 0.1%. In contrast, the best data we can see from COVID-19 is that the mortality data ranges between 1 and 3%, making it over 10 times more deadly than the seasonal flu. The next important understanding is that COVID-19 can cause severe illness in young and healthy adults. While the data does indicate that the elderly are the most susceptible and the most likely to develop critical illness, there are case reports of young, healthy adults who develop severe symptoms. Furthermore, even in the young, healthy population, it is important and a moral duty to ensure that we protect our elderly and not carry the disease home to them. Lastly, the transmission of the virus can occur without a person showing symptoms. The idea that an asymptomatic individual is safe from spreading the virus is a dangerous misconception that can lead to many people being sick. So what can you do to help? The most important thing you can do is stay home. The virus can only be spread from person to person, and so if we minimize our contact with other people, that's going to help slow the spread. Remember, this virus will spread throughout the community. It's the rate at which we transmit it that will cause the biggest problem. If it transmits quickly through the community, it will very likely overwhelm our healthcare system, and available hospital beds will not be there when we need them. If you must go out in the public, consider a mask when in close contact with any of the general public, and wash your hands frequently. Remember, the virus can live for several hours to days on surfaces, so when you're out in public touching things like door handles and gas station pumps, these things can carry the virus, and you should sanitize your hands often. If you don't have access to soap and water, alcohol-based hand sanitizers are an appropriate substitute. Thank you for taking the time to watch the video. If you have any questions regarding how you can help better protect yourself and your family, please contact the Washington County Emergency Operations Center. Thank you.